on that recorded vote until later in the markup.
Mr. Chairman,
Yes, ma'am.
I have an amendment at the desk.
My colleague from Texas has an amendment. Would you report that out, Mr. Clerk, and give us just a few minutes or a few seconds to circulate that?
Amendment number 10 on health offered by Ms. Jackson Lee.
My friend from Texas, Ms. Sheila Jackson Lee, we yield 4 minutes.
And we are friends from Texas, Mr. Chairman, and I wish that we could move and proceed accordingly, because I don't think any American benefits from a government shutdown. I'm wearing red today, standing in solidarity with the UAW workers, who obviously would be hurt by the continuing conditions they experience, just as the writers in California are suffering from the conditions they're experiencing. This amendment stops the threat of a government shutdown by restoring 2024 appropriations to the funding levels agreed to in the Fiscal Responsibility Act of 2023. It prevents the dangerous cuts envisioned by extreme actions in this House by the majority, particularly reductions to protect or to programs that protect health and well-being of Americans. Let me put into the record, because a good friend obviously cited Singapore, 334,223,854 people are in the United States as of January 2023. Don't think in any way Singapore competes. We like the work Singapore does, but they benefit by the trade they do with the United States. We're trying to fix and help the people in this country. And so my amendment is to emphasize protecting them. This increase to the budget authority and outlays for Function 550 will prevent extreme funding cuts that stifle life-saving biomedical innovation, surrender to ongoing public health crises in mental health, opioid use, HIV/AIDS, and health disparities. In particular, this would save the National Institutes of Health by $17.4 billion. It is below the enacted level funding, including a cut of $216 million for National Cancer Institute, a cut of $139 million for the National Institute of Neurological Disorders and Strokes, a cut of $139 million for the National Institutes of Mental Health. All our local communities like Houston, Texas, and other states and cities depend on. A cut of $1.5 billion for the National Institute of Allergy and Infectious Diseases, Centers for Disease Control and Prevention, funding cut by $1.6 billion. Democrats are working with President Biden, to improve access to health care. Last year, I offered amendments in the last cycle to protect Medicaid and Medicare. And we're trying to lower the cost of life-saving drugs for Americans by slashing, but Republicans are slashing investments in health research that improves health and well-being of all Americans. Investments in research, especially those focused on cancer and other diseases such as diabetes, dementia, are critical in improving the lives of hardworking Americans. Surrender to ongoing public health crises. As I indicated, funding cuts to substance abuse, mental health services, and SAMHSA, Centers for Disease Control and Prevention, would worsen the conditions of Americans, harm women's health, provide access denying them access to health services, would harm women's health and deny women's rights to privacy, autonomy, reproductive rights. In addition, this would hurt and cut funding for maternal and child health block grants and eliminated funding. Family planning. So the Jackson Lee Amendment is responding to the over 334 million Americans, hardworking Americans in this land, restoring our numbers back to the appropriate 2024 appropriations level. Submitting to the record a statement, House Fiscal Year 2024 Appropriations Bill, governed by our Republican friends, reveal an extreme agenda that would set women back decades. Please join me in a bipartisan effort to at least give one of the greatest obligations we have, besides democracy, is to keep our people healthy and having access to good health care. Join me in supporting working Americans by supporting the Jackson Lee Amendment.
Your submission, Ms. Lee, without objection, is so ordered.
Thank you, Mr. Chairman.
And now I will ask if there are any members who would like to claim time in opposition to the amendment. Ms. Spice from Oklahoma, yield 4 minutes.
Thank you, Mr. Chairman. This amendment is unnecessary. Our budget proposal does not cut any of the priorities mentioned. The proposal continues investment in biomedical research and public health. It also is extremely important as our nation responds to the deadly opioid and fentanyl epidemic. The budget prioritizes our nation's response to the deadly opioid and fentanyl crisis by including a policy statement directing resources to combat fentanyl and opioid abuse. It also includes efforts to secure the border and reduce the supply of harmful drugs into the nation. You know, it's sort of ironic that this amendment claims our budget includes, quote, funding cuts that stifle life-saving biomedical innovation. President Biden and Democrats' Inflation Reduction Act established government price setting for medicines in Medicare, restricting seniors' access to innovative cures and therapies. This has stifled patients' hope for new drugs, especially for pediatric and rare disease patients. Even the CBO's nonpartisan analysis concluded the Inflation Reduction Act will lead to fewer medicines reaching patients. Mr. Chairman, I ask unanimous consent to submit this article from the Wall Street Journal detailing how Democrats' drug price-setting policies are already killing new development of cures and therapies into the record.
Without objection, so ordered.
Thank you, Mr. Chairman. This amendment is unnecessary. It ignores the budget commitment to life-saving biomedical research and innovation and investment in public health priorities, including our response to the opioid crisis. I urge a no vote on the amendment, and I yield back the balance.
I thank my friend from Oklahoma and yield 1 minute for closing comments. And after this amendment, we're going to pause for everyone to go vote and come back here at 2:30, if you would, please. Ms. Sheila Jackson Lee, 1 minute.
Mr. Chairman, thank you so very much. There's nothing that has been offered in opposition to, in complete clarity, suggest that the draconian cuts that are occurring will not stifle life-saving biomedical innovation, worsen ongoing public health crises and mental health, opioid use, HIV, AIDS, and health disparities, and in particular, women's health. The opponent has no basis on that. We know that if you make these kinds of cuts, you will interfere with and absolutely undermine these very specific programs. But let me also add the crisis that I face in my state of Texas. I've joined Congressman Doggett in a letter that has asked CMS to stop Texas from eliminating people based on procedural errors, their errors. We lost 100,000 people off of Medicaid because of Texas errors on the procedure. And just a few days ago, 24,000 children lost Medicaid. When you make these kinds of overall cuts, you don't know what havoc you're creating. This draconian shutdown budget is creating havoc, and you're taking health care from hardworking Americans, including those like the UAW workers, the writers in California, and any other worker who's out there every day trying to support their families. I ask my colleagues to support the Jackson Lee amendment. We try to put the House back together again. We try to rebuild the house that has been torn down. We try to help men and women and families have their lives saved. And I ask support for this amendment.
The question is on agreeing to the amendment offered by Ms. Jackson Lee. All those in favor say aye.
Aye.
Those opposed, no. In the opinion of the chair, the noes have it.
Mr. Chairman, as I ask for a roll call, may I ask unanimous consent to put this letter to CMS on September 19, 2023 into the record?
Absolutely, without objection,
And
so
a roll call
ordered.
vote.
And we will roll call according to the agreement.
Thank you, Mr. Chairman.
Later on in the markup. Now, the committee will now recess, subject to the call of the chair. We'll see you back here at 2:30.